Hi everyone, welcome to episode 21 of Let's Talk Mental Health. On today's episode, our topic is eating disorders. Eating disorders are serious health conditions that affect a person's physical, mental, and emotional health. It also affects the person's ability to function in important areas of their lives. These conditions include problems in how you think about food, eating, eating behaviors, body weight, and body shape. Symptoms vary on the type of eating disorder that a person may have. The first type we'll be talking about is anorexia, also known as anorexia nervosa. It includes an unhealthy low body weight, an intense fear of gaining weight, and a view of weight and body shape that is so unrealistic. It may involve the person using several methods to lose weight, for example, exercising too much, using laxatives or diet aids, or vomiting right after eating. The second type of eating disorder is bulimia nervosa. Bulimia nervosa is another serious and life-threatening eating disorder. It involves episodes of binging, that is where a person eats a lot of food in a short period of time, and then followed by episodes of purging, vomiting. They eat and vomit. In bulimia nervosa, the person has an unhealthy obsession with how they look, with their body weight, their shape, and their appearance. In this type of eating disorder, the person is preoccupied with their weight and they have a really harsh self-judgment on how they appear. The third one is binge eating disorder, and that is simply eating a lot of food in a short period of time. The next type of eating disorder is avoidant or restrictive food intake disorder. This type of disorder is about a person limiting certain foods or not eating certain foods. For this type of disorder, the person doesn't have a fear about their body weight, their appearance, or their shape. Their only fear is eating certain kinds of food. And they may think whether when I eat this food, maybe I will choke, I will vomit, or it will upset my stomach. Now we want to look at causes and risk factors of eating disorders. There's no exact cause of eating disorders as other mental health conditions. So, one will have genetics, and then biological factors like changes in brain chemicals can lead to different types of eating disorders. And then for the risk factors, number one is family history. It is possible that if a sibling or a parent had a particular eating disorder, it can also pass down to the next person in the family. And then we have history of weight, bullying, stress as well. Dieting or starvation can also be a risk factor. And other mental health conditions like trauma, anxiety disorders, depression, or maybe obsessive compulsive disorder. These disorders can also lead to a person having an eating disorder. When to see a doctor? You can see a doctor when you're skipping meals or making excuses for eating, when you're on a highly restrictive diet that wasn't prescribed by any medical professional, when you have too much focus on food or unhealthy eating. Another one, when you're always talking about, I want to lose weight, you're not satisfied with your appearance, frequently checking in the mirror to see your body shape or how you appear. Also, when you're repeatedly eating large amounts of food, exercising much more than the average person, using dietary supplements or herbal medications to lose weight, and leaving meals or right after the meal, you're going straight to the toilet. That's another sign that you need to see your doctor. Eating in secret and talking about how ashamed you are of your eating habits. We move on to a prevention. There is no sure way to prevent eating disorders, but you can take steps daily to have healthy eating habits. If you're an adult, choose a healthy diet rich in whole grains, fruits, and vegetables. Don't depend on dietary supplements, laxatives, or herbal products to lose weight. Get enough physical activity and seek help from mental health professionals if you're dealing with depression, anxiety, or you have issues with self-esteem and body image. For children, avoid dieting around your child. Talk to them about the risks of eating unhealthily. Also, encourage or reinforce a healthy body image. No matter the size or the appearance or the shape, tell them that they're beautiful no matter how they look. And also ask your child's healthcare provider for help. And that's about it for today's episode. I hope you learned. Remember, an informed mind leads to a changed behavior. I'm Reverend Smallwood, a clinical social worker, and until our next episode, adios.